Welcome to episode 41 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're discussing the cardiac cycle, which is a sequence of pressure and volume changes that occur in the heart during one complete heartbeat. This episode will focus specifically on systolic and diastolic blood pressures, aortic pressure dynamics, and the difference between the right and left ventricles. By the end of this episode, you should be able to explain when these pressures occur, why they happen, and how the two ventricles differ in function. So let's get started. Blood pressure is one of the most important physiological measurements representing the force exerted by blood against arterial walls. It is measured in two key phases. Systolic blood pressure is the pressure in the arteries during ventricular contraction. This occurs when blood is forcefully ejected from the left ventricle into the aorta, causing the arterial walls to expand. This is the maximum arterial pressure recorded during the cardiac cycle and is typically around 120 millimeters of mercury in a healthy individual. Diastolic blood pressure, on the other hand, is the pressure in the arteries during ventricular relaxation. While the heart is refilling with blood, arterial pressure remains elevated due to the elastic recoils of the arteries, which helps maintain continuous blood flow even when the heart is at rest. This is the minimum arterial pressure, which is typically around 80 millimeters of mercury in a healthy individual. Now, aortic pressure fluctuates between systolic and diastolic phases. During ventricular ejection, blood rapidly enters the aorta, causing a sharp increase in aortic pressure. When the semilunar valves close at the end of systole, a brief pressure drop occurs, creating the dicrotic notch in the aortic pressure curve. This small pressure rebound is due to a brief backflow of blood against the closed aortic valve before full relaxation occurs. Now, a common misconception is that both ventricles, right and left, generate equal pressure. In reality, while the volume of blood entering and leaving the right and left ventricles is the same, the pressure generated by each ventricle is vastly different. And this occurs due to differences in resistance. The right ventricle pumps blood through the pulmonary circuit, which is a low-resistance system. As a result, systolic pressure in the right ventricle is much lower, about 20 millimeters of mercury. The left ventricle must pump blood through the systemic circuit, which has much higher resistance due to the longer vessel pathways and numerous branches. To overcome this resistance, the left ventricle generates a much higher systolic pressure, about 120 millimeters of mercury. Now, although systolic pressures differ, diastolic pressures between the two ventricles are similar, ensuring that equal volumes of blood are moved through the pulmonary and systemic circuits. So why does the left ventricle work harder? Well, the systemic circuit includes longer vessels, more resistance, and the challenge of gravity, particularly for blood returning from the lower body. And as a result, the left ventricle has a thicker muscular wall to generate the higher pressures needed to push blood effectively. So let's summarize with our 5 key takeaways. Systolic blood pressure occurs during ventricular contraction and reflects the maximum arterial pressure, approximately 120 millimeters of mercury. Diastolic blood pressure occurs during ventricular relaxation, which is maintained by and caused by arterial elastic recoil. And this value is usually around 80 millimeters of mercury. Aortic pressure rises during ejection and falls during diastole, with a dicrotic notch occurring at semilunar valve closure. The right ventricle pumps at much lower pressure, about 20 millimeters of mercury, while the left ventricle must overcome systemic resistance and it pumps at a much greater pressure, about 120 millimeters of mercury. Despite pressure differences, both ventricles pump the same volume of blood per beat to maintain circulation. And so with that, we're done with episode 41 of the Pulse of Physiology. I hope this episode has helped clarify the pressure and volume changes that define the cardiac cycle. Join me next time for episode 42, where we'll explore cardiac output and how the heart adjusts to meet the body's demands. Until then, keep questioning, keep exploring, and stay curious.